everybody. We're here live, Instagram, Facebook. Welcome. Amber and I are here to talk to you tonight about a few things. So we'll let everybody get on, and we're here in the theater tonight. It's so strange being in here and all our seats are empty. Beautiful red velvet seats. Hopefully in the fall, when we restart our proper seminars again, you'll all be able to come here, join us in Tequesta, and enjoy our Burt Reynolds Theater with the perfect red velvet seats and our beautiful lobby and wine and food. So pick up a glass of wine at home and pick up some food and sit back and enjoy us. This will be about a 30-minute talk about Sculptra and Kysse. Yay! So please ask questions. We love to, you'll be live just if you're thinking of something. Nobody knows who you are, so it's easy to ask a question. I'm going to tell you a little bit about myself, and Amber will tell you a little bit about herself. I'm a board-certified MD. I'm an internist by training, practiced for 30 years, and I've been doing aesthetic medicine for 20 years. So I started way back in the day, and I love it. All I do is injectable, non-surgical medicine. We do that all day long, and we love it.
Full time.
And Amber.
Hello guys, my name is Amber. I have been a nurse practitioner now for 7 years. I've worked in dermatology, oculoplastics, and now full-time aesthetics, and I absolutely love what I do.
I think it makes a difference.
Yeah.
You can tell when somebody, when they're just doing it to do it, or when they just really
have a passion for it.
Yeah, and we do. We love it. So, we are honest, we have lots of experience, and we tend to want to do natural, and I think that's what everybody loves about coming to Renew. So we're going to talk about Sculptra and Kysse tonight, and the way we like to do it is, Amber's a little bit younger than me.
Just a short amount.
So we're going to talk, she'll talk to you a little bit about what we call prejuvenation, and I'll talk about rejuvenation. So Sculptra, I just want to remind everybody tonight, 15% off Sculptra and Kysse, and we have Tiara at the office on the phone, and you can give us a call and go ahead and prepay. And then we do have giveaways based on participation, so the more questions you ask and the more you participate, you might just win one of those. It's a skincare product, so ask your questions. So Renew Lift is something that I came up with, and it's really more about what you need specifically. So Amber, at your age, a Renew Lift is pretty easy.
Yeah. Just maybe a little bit of filler or continuing to do your lasers for your skin tightening, but something not too extensive.
So for an older person, it might be a little more complex. It could be neuromodulator like Dysport. It could be, Sculptra or Radius to give you more volume. It could be filler around the lips. It could be, a whole lot of different things. Skincare is always in the mix. So it's really what it comes down to is what you want, what you need, and global rejuvenation. So you don't look kind of choppy and here and there. So we're gonna go ahead and tell you a little bit about Sculptra as it relates to the aging face. So a lot of you've seen this picture. I like it because it explains how we do the things we do. So when we're aging, we lose bone, we lose fat, we lose muscle, all our supporting structures.
Collagen,
Yeah.
all of it.
So
it all starts to fall. Sad.
Yeah, it is, but the great thing about your age is you have all these tools to, kind of counteract some of that. So with Sculptra especially, and I'll talk about how it works, at your age, you don't need it right now, but you could do baby amounts of Sculptra because it's going to help to produce collagen, and then as you're losing fat, you're going to be gaining collagen, and so you're just basically never going to age.
Pick the right field.
It's perfect. So, when we see these changes with bone and structural support, well, Sculptra is injected deep, and it's going to stimulate that structural support back. So really, seriously, if you start early enough with rejuvenation.
Exactly. I see a lot of these women coming in that maybe tend to go through cheek filler more rapidly because they work out, they have a high metabolism, and what's a really good option is Sculptra, because Sculptra is your own collagen. So people in their 30s, 40s, and this might be a really great alternative. Also, it's the safest one to inject in the temples, which a lot of people don't think about, but the temples, they start to cave in and age us. And because this is liquid, we can aspirate in that area and it makes it a very safe injection.
So temples, even if you're doing some type of more solid filler down in your lower face, a lot of people as they age and they lose fat and they lose volume in their temples, we want to puff that up again. So, you know, I do not like to put solid fillers in there. I've told you a lot, you know, I've gone back and forth, but I just think it's not safe. Even if people talk about aspirating back, you really can't with, even if it's a hyaluronic acid filler, you can't pull that filler back, it's too thick. But Sculptra is a liquid when we're injecting it, so it's perfectly safe. And all my temples, you know, I've always told Amber, nothing but Sculptra in the temples.
Sure.
So that's a very good point. So we talk about different fillers, hyaluronic acid fillers, you know, they're soft and natural and they're beautiful, but where Sculptra really kind of shines is it's a biostimulatory filler. And the two biostimulatory fillers are Radius and Sculptra. Radius is more immediate and Sculptra is more long lasting, and it takes a little slower time to see the results. So Sculptra is actually polyallolactic acid, and it's what resorbable stitches are made from. So we inject it as a liquid, like we were saying, and how many sessions do we usually do?
For the first time, you're going to get injected, and then 8 weeks later, you'll come back and get one more injection, and that should be your base right there. Every year, you're going to come back and get another maintenance.
Right.
But for some people who are younger, they might not need as much as a loading dose is what we call it. So it's kind of just, you have to come in for the consultation. We can kind of tell you about how many vials you're going to need.
Right. So the company always says 1 vial per decade, and honestly, I never go by that. Just basically because every face is different. So if Amber came to me and she said, you know what, I just want to make sure I never age, and I want Sculptra. Well, obviously, I would put 1 vial in her.
Yeah.
And then in 8 weeks, we'd see how she is. She may just need 1 vial once a year just to kind of maintain her. And then as she ages and she starts to lose more volume, maybe we'll up that. So somebody who's in like their 40s, 50s, and above, they're going to definitely need 2 vials. And then they're going to need another 2 vials 8 weeks later. And most of my patients, honestly, at that
do
point,
pretty good with 4.
Exactly.
Most. I'd say a good 95%.
right on it. That's
Yeah.
perfectly right.
Yeah.
And then once you're what we call fully corrected, which basically means that you look in the mirror, you say, wow, I look great, I love it. And then we go from that point on, 1 vial once a year to maintain, which is great. I always say we've got a date.
Yeah.
We see each other once a year.
And another great thing I like about Sculptra is I think it, like, the skin integrity even gets better. Don't you agree? Like, they glow off of that
They get
Sculptra.
that Sculptra glow.
Yeah.
And you'll see that I have a bunch of before and afters to show you today. You'll definitely see that. That's something to look at. And there's actually a study that was done that it shows that it changes the genetics in your skin, the DNA, and so it's actually improving the skin cells as well. So it's not just something that is, you know, we notice, it's something real that is scientific, which I love science. So
It's true.
it makes a lot of difference. So this is just kind of showing you this slide behind me, where Sculptra goes compared to other products. And in green is neuromodulators like Botox, Dysport, and Xeomin. We usually say upper face, but we'll talk about all the different places we can go with neuromods too. And then in the blue is more hyaluronic acids like Juvederm and Restylane and Belotero. Those, usually we're using those under the eyes and the lips and around the mouth. And that's really exactly, you know, how I love to use them. And then we have biostimulatory fillers, which are the Radius and Sculptra, which can really go everywhere, except that Radius I do not like to, again, put in the temples. Right. So it's just, it's going to give you more of a general, beautiful rejuvenation or rejuvenation.
Sure.
So, you know, the biostimulation is just really neat because, like Amber said, you know, we've got the gym, which you might hear in the background going on. I think this is their first week open. But a lot of people who work out a lot, they lose their fat.
Yeah.
They become lean.
Yes, you really do see that. You see it most noticeably in their cheeks right here. It just starts to get very gaunt, and this is something that we can give them that beautiful like little lollipop head again, and really kind of volumize them.
Yeah, it's pretty because, you know, when people get fit, their bodies look amazing, but then their face just, they can look, you know, can age them.
Yeah.
So this is a way to selectively put, you know, volume on their face without them worrying about their body.
Yeah.
So, and then also they usually have a high metabolism, so they tend to burn through these products a little quicker, and they might use Radius or Restylane in every like 3 to 4 months, and that's too much.
Right.
So when they start on Sculptra,
They're maintained because it's
Yeah.
their own collagen. They don't burn it as quickly, so it's really nice.
it's beautiful. So the thing about Sculptra, I think that's the hardest is we talked about immediate gratification. I talk about it all day.
Yes.
You too.
Everyone loves it.
So Sculptra will not give you that. You have to kind of plan ahead. So it takes about, you get your vials, and that day you're gonna look gorgeous. You're gonna just, I always say, go out and party like there's no tomorrow. Enjoy your face, and then 2 days later, all the fluid that it's mixed with goes away.
Yes.
And it's the Cinderella effect. So then over the next 6 to 12 weeks while you're building that collagen, then you'll see that revolumization, and it's really something that sometimes people come back and they say, I'm not sure I see a whole lot.
Yes. But when we compare the photos, and we always do, you will see the change. You just don't see it every day because you're looking in the mirror. But when you wait the 3 months and come back, you will definitely see the change.
And I think it's beautiful that way
Yes.
because, you know, some people don't want to walk in the office looking one way and walk out looking another.
True.
So they like that gradual effect. And I think men especially, they do great with Sculptra
Yes.
because, you know, they're not going to
They
look
want-
different.
Yeah, they want to be more conservative and just Benjamin Button naturally.
So we talked about everything, basically your 2 sessions, 2 months apart. The Sculptra itself will last 2 to 3 years. So once you're corrected, if you sit back and do nothing, you come back in 3 years and you might be back to where you were.
Right.
That's why we recommend once a year come in, maintain. Yeah. And it's very natural looking. I mean, you know, it's important to know that when you're doing Sculptra, you have to go to somebody that's done it a lot. It's the one product that, you know, you really need an advanced injector because the only way to screw Sculptra up is to basically put it in the wrong place,
Yeah.
wrong way, and I've seen some of those patients. But the good news is they're fixable. You can always treat them. So I'm going to go through some of our before and afters. This patient, you know, before she's not looking bad, but she's just become, like Amber, we talked about, that gauntness. And you can see that now she's revolumized globally, and she just looks kind of more relaxed. And pay attention under her eyes. You can see that it helps under the eyes. We don't inject the Sculptra there, but it always improves the collagen under the eyes as well, so that volumization. And a lot of times it's just when we pull the cheeks up.
cheek in that vector.
So here's another patient. This is aging in reverse, which a lot of our patients do. So the picture you see on your left is the 2017. And the picture on the right, she's had Sculptra and laser. So she's really in her maintenance, and she definitely looks a lot younger than she did 3 years ago. And not many people can say that. And you can also see her skin, you know, how she's got that glow, and, you know, a lot of times we get these waterfall lines as people age and they lose that volume, so it really helps. And then if you add the laser into the Renew Cool laser,
That's killing it. Multiple modalities is really to get that 3D best effect. Yeah.
The trifecta. So this is a patient, you know, she's really lost a lot of volume, and you can see her skin kind of sagging. And then she's gotten 4 vials, and she had some Botox done. And beautiful, beautiful Yeah, her
Really
jawline is amazing. Sometimes we'll pop a little radius in the jawline when people are doing their maintenance. That's
Yeah.
something new we've been doing.
Yes.
And we've got their volume, but radius does a really nice, succinct jawline. But hers is gorgeous with the Sculptra. Beautiful. And her skin, look at it. You can see that glow, the light reflecting off of it, and really perfect. Another older patient and really kind of deflated. I always say, like with Sculptra, it's almost like blowing up a balloon.
Yes.
You know, you've got a balloon that's been sitting on the ground for a little while and it becomes a little crinkly and wrinkly. And then you just, if you could just throw some helium back in there, it just whoop, and that's what happens with her face. Gorgeous, gorgeous. And one thing, she did have a little bit done on her lips too, which is nice. And we're going to talk about her lips in a second because we have a new exciting product for lips. You know, we talked about combination therapy is always
That's the
always
way to go.
best. You know, we talked about Sculptra and we're going to talk about Dysport. The Renew Cool laser is something that's wonderful that is paired with that. It's a fractional CO2 laser that really gives you like 1 or 2 days of downtime and great smoothing pigment pores.
Wrinkles, everything, tightening under the eyes, around the mouth, like you said, the waterfall lines. It's really, really nice.
And that's great at any age.
Any age.
You know, 20-year-olds, they probably need one.
Oh
but
yeah, they do. Yeah, just one. But every of my millennials that I've been treating, after they have this laser, they say that they just would never go back to like microneedling or facials as upkeep because this is the one and done for skin resurfacing.
Yeah, because it lasts years. So
Right.
that's also on special this month too, and that's one of the reasons I wanted to talk about it. And then we're going to talk a little bit about Dysport. Restylane is also on special this month too, and that's awesome when paired with, you know, the Sculptra. I do a lot of Sculptra, we do a lot of that where we do lips too with it.
Yes.
And we've got a new product, but this is somebody who's had a great transformation plan. She had the 4 vials with the Sculptra, so 2 and 2, and then we also did her lips, so helped her lip lines.
Yeah, you could really see it in her mid face here.
What else does she need, Amber?
Oh, maybe just that cool laser. Just to kind of icing on the cake.
Yeah, because then we could like tighten up her eyes
Little perioral lines.
and that's what happens once we fix one thing,
Then we see something else.
and actually you see something else too. So it's amazing. So this is someone, older patient. She's had
So amazing.
Restylane silk in her lips, and she had the laser.
I know, yeah.
So she had the trifecta, and she just looks so relaxed and youthful and happy. Every time she comes in now, she's got the huge smile because she's just feeling, you know, when you look good, you feel good.
Absolutely.
And I think with this going on, we've seen, you know, we've been open now for 2.5 weeks. And
People are racing in here.
nobody's talking about COVID in our office. They're just happy
Just
to
so
kinda,
happy.
Yeah, feel back to normal. You know, get their neuromods and relaxed, and you know, not to say what's going on is not stressful. It's still stressful, but
Yeah. But when this is like a little relax from that.
yeah, that's wonderful. We all love it. So, Sculptra and Kysse. I'm going to talk a little bit just because it's brand new. It wasn't what we were talking about tonight, but I just want to put a little plug in for it. We did Amber's lips yesterday. We did our first kiss.
I loved it. I absolutely loved it. It's a wonderful product. It feels natural. It feels good. And the best part about it, I think, that how long it lasts.
Yeah, it's the first filler that is FDA approved for the lips for a year. And, you know, like our Galderma rep says, it's made just for the lips.
Yes.
And, you know, in injecting it, I can see that. It's very smooth. It's very versatile. We can do like little tiny lines and we can do volume.
Yeah.
All with the same product, and that's really, we haven't had that before.
Unprecedented, yeah. Usually to build volume, you need a thicker HA filler, and then for those little fine lines, a thinner one. But
Right.
this one seems like
Because
you can do it all.
Don't want it to pop out.
Right.
And, you know, this really smooths nicely. So we definitely would be having this product in our office, and it's exciting. So I think it's going to really change things, and I can't stop looking at it.
Thank you so much for that.
So now we're going to talk about Dysport a little bit, and you talk about this kind of different places we can put it.
So with Dysport, the positive thing with this is that it will kick in around day 3, whereas Botox will kick in around day 7. So if you want something fast acting, this is definitely the one to go for. The other thing with this is that it spreads so nicely. So it really just gets all those little crow's feet or forehead lines for usually not even that many units because of the nice spread. Also, they are saying that it's starting to last a little bit longer. Like most neuromods, clinical studies show that it lasts 3 months. But I think Dysport's now coming out with 4 months. Is it like 4 months or so, where it can last that long? So the one other thing I'll say about Dysport is if you're looking for a more natural movement, it will freeze your muscles, but you won't be frozen. So if you want something natural, but just softer, Dysport's for you.
Yeah, I think, at the end of the day, I think all the neuromods are kind of similar, If we were able to just inject whatever we wanted in the patient and not tell them, I think for most people, 80%, they'd all be about the same. But there are some neat nuances, and the spreading of Dysport is nice, especially crow's feet, forehead. You don't have to start and stop it. All it's just smooth and natural.
Right.
So, it definitely has its differences, and most people find it kicks in much quicker, which is always nice. Again, immediate gratification. This is kind of telling you about some of the areas that we can put it into that you might not know. I mean, everybody knows about frown and crows and forehead, but my favorite area, you want to know where mine is, everybody knows chin. I love chins because, a lot of people don't take care of their chins as far as Botox. They don't know to do that over Dysport. So your chin muscle, a lot of people use that with their stress. Kind of crunch it up and pop a little bit in there, smooths it out, and prevents you from getting cobblestone. What's your favorite area to put Dysport in?
My favorite would probably be the lip flip. So it's for the people that I love it. So people that are a little bit afraid of getting fillers in their lip, I always suggest doing a lip flip. It's very simple to do. Put a little bit in the top lip, and you'll see that pink just start to roll out a little bit. And then if you love that, then you'll be in my chair next for lip filler.
Yeah,
it's like a gateway.
Right, exactly. We do that a lot. It's really funny because a lot of the older patients are really afraid of doing their lips. So it's a nice way to show them, okay, this is what it would look like if you got a little fill in the lips, and then they're like, oh, I like that.
Yes.
So it's really a nice, easy way to tell when you like your lips a little fuller. The pores is something kind of cool.
That is cool.
We have our Renew Microtox, and Amber's going to tell you about that.
We have a question about Dysport. The question says, how often can you use Dysport? How do I know how much to buy?
Okay, good question. If you tell us what areas you want to do, we can probably give you a little estimate, because different people need different amounts, but if you tell us the areas, like if it's the frown or the crows, and afterwards, if you wanted to talk with one of us, we can kind of help you out with that. Most people need it about every 3 to 6 months is kind of the average. And there's always outliers and everything.
Yeah.
So we get some people that go 8 to 12 months.
Right.
We all hate them.
Yeah, they're unicorns.
Yeah. But they, most people it's 3 to 6 months.
Yeah.
So good question.
Very good question. I want to introduce this to you. This is going to be our little appliance that we are going to be doing our Renew Microtox. So basically, with this little appliance, we're going to be able to put hyaluronic acid and a neuromodulator like Dysport in here, diluted, and then it's just like stamped along the face. With that, it will close down your pores, and it can also treat necklines with that. So this is a really fun, quick device, 0 downtime, and you're going to get all those big pores on your cheeks, on your nose, on your forehead, and fine lines and wrinkles. You're going to look amazing, glowing afterwards.
Yeah, that's great, and it lasts about 6 months.
Yes.
So it's something you come back and do 6 months, but it's just like that instant glow. Skin will feel a little tighter. Pores, if somebody's struggling with large pores, it's really interesting how the Dysport works. I mean, it's amazing.
It really shrinks them.
Yeah. So some of the other areas, neck bands, we can kind of lay the neck bands down. Sweating, if you have something called hyperhidrosis, we can inject it in the armpits. That lasts like a year. Masseter muscles too, like people who have TMJ.
Yes.
This is really nice. I mean, just put a little bit in there and relaxes those muscles.
We have another question.
Yeah.
Is Dysport similar to Xeomin?
Yes, actually, Dysport, Xeomin, Botox, they're all what we call neuromodulators. So they will relax your muscles that make lines and wrinkles, and by doing that, we soften the lines and wrinkles. Great questions. Somebody must want a prize. So we've got our specials tonight. Anybody have any other questions about anything? Just let us know. But I think we've pretty much gone through nuts and bolts of Sculptra and Dysport.
Yes.
And we do have the 15% off tonight if you give us a call. That's till midnight too, so if nobody answers and you leave a message, we will honor that. But if you don't want to commit or you didn't see this when it was on, it's 10% off for the rest of the month, and with the Renew Cool Laser and the rest one as well. So really kind of, just trying to help everybody out right now.
Amazing deals.
We are going to continue doing these webinars because I'm getting a lot of feedback. People are really enjoying them. Even if you don't get to see it right at 5:30, you can watch it, at your leisure, because it'll be on for 24 hours on Instagram and Facebook. And then we're going to have a link to put it on YouTube, and we'll be emailing that out and posting that. So you can watch these anytime you want. Our goal is really to educate everybody. Yes.
So we have another question. What can you do for the neck once your face is younger looking?
Really good question.
That's
Because that
amazing.
happens a lot.
Yes, yes.
People work on their face, and then they go, "Oh, my neck looks like a baby."
Right, right.
So, what would you recommend for the neck?
Well, it depends on what is the problem. So if it is too much volume here, I would maybe think about doing some alt therapy for lifting. Okay, we'll talk about that, I'm sure, in another webinar. But alt therapy, and then if it's a laxity issue, so lots of wrinkles, then it's that Renew Cool Laser. But another fun thing that we can do is we can do fillers in that area too. So if you want the wrinkles to go away, maybe some filler and the cool laser.
A lot of different options. So, it's good to say, good to come in. You can even do like a video consultation. We're now really great at that.
Yes.
So, we can kind of look at things and see what you need and give you some recommendations. But there's a lot of things to do in the neck. We also have DCA, deoxycholic acid, to melt your fat permanently.
Yes.
We can do the neuromods for the neck bands, and then the fillers in the neck are great. So that gives you collagen, over time, but also gives you an immediate smoothing. So these are all great options. Do you have another question? Yeah.
Yes. Is there a device that shrinks the pore and fine line on special right now?
Yeah, we do have the Renew Cool Laser, which is on special till the end of the month. So that will really help you with your pores and fine lines. It's like nothing else, because it's fractional CO2 laser. So that's the gold standard always, but the problem's always been the downtime, and the Renew Cool Laser has like 1 or 2 days of redness, and that's it.
That's it.
24 hours and...
Yep, go back to your normal life after 24 hours. Gym, sun, we don't ever recommend it, but you can. No sun. But you can go right back after 24 hours.
So we are going to continue our webinars. So the 2nd and 4th Wednesday of each month during the summer. So June, July, August, 2nd and 4th Wednesday. We'll be sending that schedule out. We're going to put together a bunch of topics. But if there's something somebody wants to hear about, just shoot us a DM or a text, or just let us know what you want to hear about, and we can do a little webinar on it.
Yes. Another viewer asks, I'm wondering how painful injections are. I'm scared of needles and even pass out when I get blood taken.
you are in the right place.
Yeah.
We can take care of it. I have, I've had a lot of people come, and you probably too, that, that don't do well with needles, and, it's always the first time is the hardest.
Yeah,
Lot
you
of
don't know what to
anxiety.
expect. Once you know, you're fine. But we have
Yeah.
the magic gas now.
Our renewed happy gas, we call it. It's basically the nitrous, and it's just gonna put you in a really happy mood. So if you're somebody that, I always say pain is anxiety.
Yeah.
So if we can treat your anxiety, which the happy gas does, we also could give you a Xanax or a Valium to take. We do a lot of talk anesthesia, and breathing is honestly, if you've passed out before, it's because you've held your breath.
Yeah.
Yeah, I mean, most people, if they breathe, if we're reminding you to breathe, it's not an issue.
Right.
And, if we think you're gonna pass out, we put you down. We rarely have anybody pass out.
Never.
Because, especially if we know that there's
Yeah.
somebody that does, then
Yeah.
it just, we can get them through. And once you get through, when you've had a positive experience, then it tends to be easy. Yeah, we can take care of you, don't worry, don't worry. So our other thing we're doing in the summer is our Renew Ponds. So we've been doing this for about 5 years. Every Tuesday, you're gonna get an email or a text or a Instagram post or a Facebook post, and it's gonna be some amazing special. And then you have 24 hours to call and purchase it. So it's kind of fun. We have no idea what these are. We have an outside company, and they kind of just pop up, and then we're like, wow, okay, that's exciting.
Yeah.
And it's just kind of something fun to get us through the summer. So basically, that's happening every week. So make sure you tune in Instagram and Facebook. If you want to make sure you definitely get it, give us your email, and you'll get the emails every week. It's just a nice reminder, because in the summer especially, Tuesday will come around really fast.
True.
So, any other questions? Nope, we're good. Thank you for joining us, and we look forward to next week, or actually not next week, it'll be 2 weeks. And we'll be getting the schedule of topics out, so help us out.
Yes.
We
Thank
want
you.
to make sure that we educate everybody.
Thank you so much for joining tonight, guys. Love you, and I hope to see you here.
All right, everybody. Mwah.